Key points. There are different types of treatment for patients with adult Hodgkin lymphoma. Patients with Hodgkin lymphoma should have their treatment planned by a team of healthcare providers with expertise in treating lymphomas. Patients may develop late effects that appear months or years after their treatment for Hodgkin lymphoma. 3 types of standard treatment are used: chemotherapy, radiation therapy, surgery. For pregnant patients with Hodgkin lymphoma, treatment options also include watchful waiting, steroid therapy. New types of treatment are being tested in clinical trials: chemotherapy and radiation therapy with stem cell transplant, monoclonal antibody therapy. Patients may want to think about taking part in a clinical trial. Patients can enter clinical trials before, during, or after starting their cancer treatment. Follow-up tests may be needed. There are different types of treatment for patients with adult Hodgkin lymphoma. Different types of treatment are available for patients with adult Hodgkin lymphoma. Some treatments are standard, the currently used treatment, and some are being tested in clinical trials. A treatment clinical trial is a research study meant to help improve current treatments or obtain information on new treatments for patients with cancer. When clinical trials show that a new treatment is better than the standard treatment, the new treatment may become the standard treatment. Patients may want to think about taking part in a clinical trial. Some clinical trials are open only to patients who have not started treatment. For pregnant women with Hodgkin lymphoma, treatment is carefully chosen to protect the fetus. Treatment decisions are based on the mother's wishes, the stage of the Hodgkin lymphoma, and the age of the fetus. The treatment plan may change as the signs and symptoms, cancer, and pregnancy change. Choosing the most appropriate cancer treatment is a decision that ideally involves the patient, family, and healthcare team. Patients with Hodgkin lymphoma should have their treatment planned by a team of healthcare providers with expertise in treating lymphomas. Treatment will be overseen by a medical oncologist, a doctor who specializes in treating cancer. The medical oncologist may refer you to other healthcare providers who have experience and expertise in treating adult Hodgkin lymphoma and who specialize in certain areas of medicine. These may include the following specialists: neurosurgeon, neurologist, rehabilitation specialist, radiation oncologist, endocrinologist, hematologist, other oncology specialists. Patients may develop late effects that appear months or years after their treatment for Hodgkin lymphoma. Treatment with chemotherapy and/or radiation therapy for Hodgkin lymphoma may increase the risk of second cancers and other health problems for many months or years after treatment. These late effects depend on the type of treatment and the patient's age when treated, and may include acute myelogenous leukemia, cancer of the breast, bone, cervix, gastrointestinal tract, head and neck, lung, soft tissue, and thyroid, heart, lung, and thyroid disease, avascular necrosis of bone, death of bone cells caused by lack of blood flow, herpes zoster, shingles, or severe infection, depression and fatigue, infertility, hypogonadism, low levels of testosterone and estrogen. Regular follow-up by doctors who are expert in finding and treating late effects is important for the long-term health of patients treated for Hodgkin lymphoma. 3 types of standard treatment are used. Chemotherapy. Chemotherapy is a cancer treatment that uses drugs to stop the growth of cancer cells, either by killing the cells or by stopping them from dividing. When chemotherapy is taken by mouth or injected into a vein or muscle, the drugs enter the bloodstream and can reach cancer cells throughout the body. Systemic chemotherapy. When chemotherapy is placed directly into the cerebrospinal fluid, an organ, or a body cavity such as the abdomen, the drugs mainly affect cancer cells in those areas. Regional chemotherapy. The way the chemotherapy is given depends on the type and stage of the cancer being treated. Combination chemotherapy is treatment with more than one anti-cancer drug. When a pregnant woman is treated with chemotherapy for Hodgkin lymphoma, it isn't possible to protect the fetus from being exposed to the chemotherapy. Some chemotherapy regimens may cause birth defects if given in the first trimester. Vinblastine is an anti-cancer drug that has not been linked with birth defects when given in the second half of pregnancy. See drugs approved for Hodgkin lymphoma for more information. Radiation therapy. Radiation therapy is a cancer treatment that uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. There are two types of radiation therapy. External radiation therapy uses a machine outside the body to send radiation toward the cancer. Internal radiation therapy uses a radioactive substance sealed in needles, seeds, wires, or catheters that are placed directly into or near the cancer. The way the radiation therapy is given depends on the type and stage of the cancer being treated. External radiation therapy is used to treat adult Hodgkin lymphoma. For a pregnant woman with Hodgkin lymphoma, radiation therapy should be postponed until after delivery, if possible, to avoid any risk to the fetus. If immediate treatment is needed, the woman may decide to continue the pregnancy and receive radiation therapy. However, lead used to shield the fetus may not protect it from scattered radiation that could possibly cause cancer in the future. Surgery. Laparotomy is a procedure in which an incision, cut, is made in the wall of the abdomen to check the inside of the abdomen for signs of disease. The size of the incision depends on the reason the laparotomy is being done. Sometimes organs are removed or tissue samples are taken and checked under a microscope for signs of disease. If cancer is found, the tissue or organ is removed during the laparotomy. For pregnant patients with Hodgkin lymphoma, treatment options also include watchful waiting. Watchful waiting is closely monitoring a patient's condition without giving any treatment unless signs or symptoms appear or change. Delivery may be induced when the fetus is 32 to 36 weeks old, so that the mother can begin treatment. Steroid therapy. Steroids are hormones made naturally in the body by the adrenal glands and by reproductive organs. Some types of steroids are made in a laboratory. Certain steroid drugs have been found to help chemotherapy work better and help stop the growth of cancer cells. Steroids can also help the lungs of the fetus develop faster than normal. This is important when delivery is induced early. See drugs approved for Hodgkin lymphoma for more information. New types of treatment are being tested in clinical trials. This summary section describes treatments that are being studied in clinical trials. It may not mention every new treatment being studied. Information about clinical trials is available from the NCI website. Chemotherapy and radiation therapy with stem cell transplant. High-dose chemotherapy and radiation therapy with stem cell transplant is a way of giving high doses of chemotherapy and radiation therapy and replacing blood-forming cells destroyed by the cancer treatment. Stem cells, immature blood cells, are removed from the blood or bone marrow of the patient or a donor and are frozen and stored. After therapy is completed, the stored stem cells are thawed and given back to the patient through an infusion. These reinfused stem cells grow into, and restore, the body's blood cells. The use of lower-dose chemotherapy and radiation therapy with stem cell transplant is also being studied. Monoclonal antibody therapy. Monoclonal antibody therapy is a cancer treatment that uses antibodies made in the laboratory, from a single type of immune system cell. These antibodies can identify substances on cancer cells or normal substances that may help cancer cells grow. The antibodies attach to the substances and kill the cancer cells, block their growth, or keep them from spreading. Monoclonal antibodies are given by infusion. They may be used alone or to carry drugs, toxins, or radioactive material directly to cancer cells. Patients may want to think about taking part in a clinical trial. For some patients, taking part in a clinical trial may be the best treatment choice. Clinical trials are part of the cancer research process. Clinical trials are done to find out if new cancer treatments are safe and effective or better than the standard treatment. Many of today's standard treatments for cancer are based on earlier clinical trials. Patients who take part in a clinical trial may receive the standard treatment or be among the first to receive a new treatment. Patients who take part in clinical trials also help improve the way cancer will be treated in the future. Even when clinical trials do not lead to effective new treatments, they often answer important questions and help move research forward. Patients can enter clinical trials before, during, or after starting their cancer treatment. Some clinical trials only include patients who have not yet received treatment. Other trials test treatments for patients whose cancer has not gotten better. There are also clinical trials that test new ways to stop cancer from recurring, coming back, or reduce the side effects of cancer treatment. Clinical trials are taking place in many parts of the country. Information about clinical trials supported by NCI can be found on NCI's Clinical Trials Search webpage. Clinical trials supported by other organizations can be found on the clinicaltrials.gov website. Follow-up tests may be needed. Some of the tests that were done to diagnose the cancer or to find out the stage of the cancer may be repeated. Some tests will be repeated in order to see how well the treatment is working. Decisions about whether to continue, change, or stop treatment may be based on the results of these tests. Some of the tests will continue to be done from time to time after treatment has ended. The results of these tests can show if your condition has changed or if the cancer has recurred, come back. These tests are sometimes called follow-up tests or checkups. Treatment options for adult Hodgkin lymphoma. Early favorable Hodgkin lymphoma. Early unfavorable Hodgkin lymphoma. Advanced Hodgkin lymphoma. Recurrent adult Hodgkin lymphoma. Early favorable Hodgkin lymphoma. Treatment of early favorable Hodgkin lymphoma may include the following: combination chemotherapy. Combination chemotherapy with radiation therapy to parts of the body with cancer. Radiation therapy alone to areas of the body with cancer or to the mantle field, neck, chest, armpits. Use our clinical trial search to find NCI-supported cancer clinical trials that are accepting patients. You can search for trials based on the type of cancer, the age of the patient, and where the trials are being done. General information about clinical trials is also available. Early unfavorable Hodgkin lymphoma. Treatment of early unfavorable Hodgkin lymphoma may include the following: combination chemotherapy. Combination chemotherapy with radiation therapy to parts of the body with cancer. Use our clinical trial search to find NCI-supported cancer clinical trials that are accepting patients. You can search for trials based on the type of cancer, the age of the patient, and where the trials are being done. General information about clinical trials is also available. Advanced Hodgkin lymphoma. Treatment of advanced Hodgkin lymphoma may include the following: combination chemotherapy. Use our clinical trial search to find NCI-supported cancer clinical trials that are accepting patients. You can search for trials based on the type of cancer, the age of the patient, and where the trials are being done. General information about clinical trials is also available. Recurrent adult Hodgkin lymphoma. Treatment of recurrent Hodgkin lymphoma may include the following: combination chemotherapy. Combination chemotherapy followed by high-dose chemotherapy and stem cell transplant with or without radiation therapy. Combination chemotherapy with radiation therapy to parts of the body with cancer in patients older than 60 years. Radiation therapy with or without chemotherapy. Chemotherapy as palliative therapy to relieve symptoms and improve quality of life. A clinical trial of high-dose chemotherapy and stem cell transplant. A clinical trial of lower-dose chemotherapy and radiation therapy followed by stem cell transplant. A clinical trial of a monoclonal antibody. A clinical trial of chemotherapy. Use our clinical trial search to find NCI-supported cancer clinical trials that are accepting patients. You can search for trials based on the type of cancer, the age of the patient, and where the trials are being done. General information about clinical trials is also available. Treatment options for Hodgkin lymphoma during pregnancy. Hodgkin lymphoma during the first trimester of pregnancy. Hodgkin lymphoma during the second half of pregnancy. Hodgkin lymphoma during the first trimester of pregnancy. When Hodgkin lymphoma is diagnosed in the first trimester of pregnancy, it does not necessarily mean that the woman will be advised to end the pregnancy. Each woman's treatment will depend on the stage of the lymphoma, how fast it is growing, and her wishes. For women who choose to continue the pregnancy, treatment of Hodgkin lymphoma during the first trimester of pregnancy may include the following. Watchful waiting when the cancer is above the diaphragm and is slow growing. Delivery may be induced when the fetus is 32 to 36 weeks old so the mother can begin treatment. Radiation therapy above the diaphragm. A lead shield is used to protect the fetus from the radiation as much as possible. Systemic chemotherapy using one or more drugs. Hodgkin lymphoma during the second half of pregnancy. When Hodgkin lymphoma is diagnosed in the second half of pregnancy, most women can delay treatment until after the baby is born. Treatment of Hodgkin lymphoma during the second half of pregnancy may include the following. Watchful waiting, with plans to induce delivery when the fetus is 32 to 36 weeks old. Systemic chemotherapy using one or more drugs. Steroid therapy. Radiation therapy to relieve breathing problems caused by a large tumor in the chest.